Bupropion Hcl Sr. is used in combination with a stop smoking program to help you quit smoking. It can decrease your nicotine withdrawal symptoms and your urge to smoke. Quitting smoking decreases your risk of heart and lung disease, as well as cancer. This medication belongs to a class of medications known as antidepressants. It is not known exactly how bupropion works to reduce smoking urges. It may work by restoring the balance of certain natural chemicals in the brain. Discuss the risks and benefits of this medication, as well as other ways to quit smoking, with your doctor. The usual dosage is 150 mg once daily in the morning. It's best to take Bupropion Hcl Sr. at the same time each day. Before starting bupropion, make sure to read the medication guide and patient information leaflet provided by your pharmacist. Take this medication by mouth with or without food, usually twice a day, at least 8 hours apart to lower the risk of seizure. If you experience stomach upset, take it with food. Swallow the tablets whole, do not crush or chew them. The dosage is based on your medical condition and response to treatment, and may be slowly increased to limit side effects. It is recommended not to try quitting smoking until you have been taking bupropion for 1 week. After that, you should set a date for quitting and stop smoking in the 2nd week of taking the drug. If necessary, this medication may be combined with nicotine patches or gum to help you quit smoking. Make sure to use this medication regularly in order to get the most benefit from it, and inform your doctor if you are unable to stop smoking after 7 to 12 weeks on this medication. As your body gets used to Bupropion Hcl Sr., you may experience dry mouth and trouble sleeping. Other common side effects include dizziness, drowsiness, nausea, diarrhea, fatigue, constipation, blurred vision, increased sweating, strange taste in your mouth, or stomach pain. If these effects persist or worsen, be sure to inform your doctor or pharmacist. It's important to note that your doctor has prescribed this medication because they believe the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects, but it's essential to monitor your blood pressure regularly, as Bupropion Hcl Sr. may raise it. Contact your doctor immediately if you experience any serious side effects such as chest pain, fainting, fast or irregular heartbeat, changes in mental or mood, like anxiety or confusion, muscle aches, severe headache, tremors, unusual weight loss or gain, muscle pain, or vision changes. If you notice symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. It's also important to note that an empty tablet shell may appear in your stool, which is harmless. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist for further guidance. Remember that this is not a complete list of possible side effects, and it's important to discuss any concerns with your healthcare provider. Bupropion Hcl Sr. is commonly used to treat depression, other mental/mood disorders, and to help people quit smoking. It can also help prevent suicidal thoughts and provide other important benefits. However, it's important to be aware that some people, especially those younger than 25, may experience new or worsening depression, other mental/mood symptoms, or suicidal thoughts when taking antidepressants. It's crucial to discuss the risks and benefits of this medication with your doctor, even if it's not for a mental/mood condition. If you notice new or worsening depression/other psychiatric conditions, unusual behavior changes, or other mental/mood changes, it's important to talk to your doctor right away. This includes new or worsening anxiety, panic attacks, trouble sleeping, irritability, hostile/angry feelings, impulsive actions, severe restlessness, or very rapid speech. Be especially watchful for these symptoms when starting a new antidepressant or when the dose is changed. If you are using bupropion to quit smoking, stop taking it and contact your doctor immediately if you experience any of these symptoms. And be sure to inform your doctor if you have any of these symptoms after stopping the treatment. Before starting bupropion, make sure to tell your doctor or pharmacist about any allergies you may have and any other medications you are taking. It's important to also discuss your medical history, especially if you have a history of seizures, alcohol or drug dependence, diabetes, heart disease, high blood pressure, kidney or liver problems, mental/mood disorders, or glaucoma. It's important to note that this medication should not be used if you are suddenly stopping the use of sedatives, drugs used to treat seizures, or alcohol, as this could increase your risk of seizures. Bupropion may cause dizziness, drowsiness, or blurred vision, and using alcohol or marijuana can increase these effects. It's important to avoid driving or using machinery until you can do so safely and to avoid alcoholic beverages while taking this medication. Older adults may be more sensitive to the side effects, especially dizziness and memory loss, which can increase the risk of falling. If you are pregnant, it's important to discuss the risks and benefits of taking this medication with your doctor. Similarly, if you are breastfeeding, consult your doctor before taking bupropion. It's important to be aware of potential drug interactions when taking Bupropion Hcl Sr. This medication may interact with other drugs such as codeine, pimozide, tamoxifen, and thioridazine. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Avoid taking MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. Make sure to consult with your doctor about when to start or stop taking this medication if you are also taking MAO inhibitors. Additionally, be aware that this medication may interfere with certain medical and lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using Bupropion Hcl Sr. If someone has taken too much Bupropion Hcl Sr. and is showing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, while in Canada, you can call a provincial poison control center. Symptoms of an overdose may include seizures, severe confusion, hallucinations, rapid heart rate, and loss of consciousness. It's important to act quickly in these situations to ensure the person's safety. Remember, it's important not to share your medication with others. Your doctor may also want to monitor your blood pressure and liver function while you're taking Bupropion Hcl Sr., so make sure to attend all your medical and lab appointments. And if you have any questions, don't hesitate to consult your doctor for more details about the medication. If you happen to forget a dose, just wait until your next scheduled dose. Do not take extra to make up for the missed dose. This medication is usually taken once or twice a day, with the second dose taken in the afternoon to avoid trouble sleeping. When storing Bupropion Hcl Sr., it is important to keep it at room temperature and away from light and moisture. The tablets may have a strange odor, but this is normal and the medication is still safe to use. Be sure to keep it out of the bathroom and away from children and pets. When it comes to disposal, do not flush the medication down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for the proper way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.